The psychiatrist versus psychologist versus psychotherapist. Whom should you consult? Last week, a patient came to my clinic after struggling with anxiety for almost 3 years. She had visited different people, spent a lot of money, and tried many approaches, but she still was not getting better. The problem was not that she was not trying. The problem was that she did not know whom to consult. Psychiatrist, psychologist, counselor, psychotherapist, whom to consult. So, if you have ever confused whom to show, or if you know someone who has been in dilemma, whom to consult, this video can help. Hello, I'm Dr. Vrushali, and I have been working in mental health since last 17 years. And one of the biggest confusions I see is that people don't know who does what, whom to consult. Let's clear that confusion today. Who is psychiatrist? Imagine your brain is like a sophisticated computer. Sometimes the software needs updating. Sometimes the hardware also develops problems. A psychiatrist is a medical doctor, understands both. A psychiatrist first completes Bachelor of Medicine and Bachelor of Surgery. This is recognized in India, and this is the 5.5 years of undergraduate medical degree course in allopathy. So Bachelor of Medicine and Bachelor of Surgery, after that, they do 2 or 3 years, 2 years of diploma, DPM, or MD, that is the 3 years. DNB is also 3 years. So after this specialization in psychiatry, after completing MBBS, it's almost 12 years of education and expertise in medicine. So because psychiatrists are doctors, they diagnose the illness, prescribe medicines, they advise investigations. If there is any physical illness along with the medical issue, if they sense that, can advise investigation accordingly, and accordingly medicines can be given. As the primary role of doctor, they do all that. And they can provide psychotherapy if they are trained into providing psychotherapy. One can consult psychiatrist if there is severe depression, panic attacks, OCD, bipolar disorder, schizophrenia, suicidal thoughts, ADHD, severe anxiety, sleep disorders that significantly affect life. Medication is not given to everyone. Medication is one of the many tools available in mental health care. Just as not every infection requires antibiotics, not every emotional difficulty requires medication. The treatment plan depends on the individual. Sometimes counseling alone is enough. Sometimes therapy is enough. Sometimes both therapy and medication together give best results. So this is about psych. Now let's see who is psychologist. Now imagine your brain's hardware is functioning, but your patterns of thinking, emotions, and behavior have become unhealthy. A psychologist studies how people think, feel, and behave. When people refer to therapy for mental health in India, they are often referring to a clinical psychologist who has specialized training and recognition to assess and treat mental disorders using psychological methods. Clinical psychologists usually provide psychological assessment, IQ testing, personality assessment, neuropsychological testing, psychotherapy. They do not prescribe medicines. So this is the primary difference. Instead, they help change patterns of thinking because they identify patterns, behavior, emotions. So they can change the patterns of thinking, emotional responses, and behaviors using evidence-based therapies. Now let's see who is psychotherapist. This is where most confusion begins. Psychotherapy is a treatment method, not a single profession. Psychotherapist is someone trained to provide psychotherapy. Psychotherapy includes approaches such as cognitive behavior therapy, acceptance and commitment therapy, dialectical behavior therapy, interpersonal therapy, trauma-focused therapies, family therapy, psychodynamic therapy. Now, these are the different therapy approaches. In India, psychotherapist is not a protected standalone legal title. So people from different professional backgrounds may use it. That's why it is important to ask about the person's primary qualification and formal psychotherapy training. A psychiatrist may also be psychotherapist. Clinical psychologist may also be a psychotherapist. Some other qualified mental health professional also receive psychotherapy training. So psychotherapy is what someone does, not necessarily who they are. Imagine two people lose their jobs. One becomes depressed, the other sees it as a temporary setback. Therapy helps us understand why our minds react differently and teaches healthier ways of thinking, feeling, and responding. It also causes level of healing when the proper structure is followed. So psychotherapy is not a separate profession, it's a specialized method of treatment. Professionals from different backgrounds, such as psychiatrists and clinical psychologists, may receive formal training in psychotherapy and provide it within their scope of practice. Some of my patients need medication for a period of time. Some benefit from psychotherapy. Many benefit from both. When psychiatrists and psychologists work together, the patient receives comprehensive care and the recovery is much better. Now let's see who is counselor. Counseling usually focuses on helping people deal with stress, relationship issues, grief, work stress, adjustment problems, career decision, life transition. Counselors generally use supportive conversations and problem-solving approaches. However, training requirements for counselors can vary widely in India, so it is important to ask about their education, supervised training, and experience. For several mental illnesses, a psychiatrist or a clinical psychologist should usually be part of the care team. Now, who should you consult? If you have, or if anyone has persistent sadness, loss of sleep, panic attacks, suicidal thoughts, hallucinations, or severe emotional suffering, start with a psychiatrist or an appropriately qualified mental health professional who can guide you to the right treatment pathway. If your concern is stress, self-confidence, relationships, life transitions, or emotional growth, therapy or counseling may be appropriate depending on your needs. Often, the best outcomes come from collaborative care, where a psychiatrist and a therapist work together. Mental illness is not weakness. Seeking help is not failure. Just as you would consult a cardiologist for a heart problem, it is perfectly okay to consult the right mental health professional for emotional or psychological concerns. The most important step is not choosing the best professional. It is choosing the right professional for the current need. Mental illness doesn't care about titles, it cares about timely treatment. Whether your journey begins with a psychiatrist, a psychologist, or another qualified mental health professional, the most important step is reaching out for help. Recovery is possible. And you don't have to walk that journey alone. There is always help available. So, if this video has helped you to clear the confusion, then please like this video, share it with someone who may need it, and subscribe to this channel for scientifically accurate, practical mental health education. If you still have questions about mental health, leave them in the comments and I may answer them in the upcoming video. Thank you. Namaste.